Dr. Parasnis, please.
Yeah. My respected chairpersons, my respected teacher, Dr. K. Sancheti, and all friends, good afternoon. When I had this title read first, I had to scratch my head exactly to understand the meaning. But as I understand, it means technology, whether science or marketing. If you see nowadays, every year there are new technologies which come. Some of them really radical, disruptive, and some of them stay for a long time. As you know that most of the gadgets are getting replaced very fast. But when it comes to our specialty, especially spine surgery, is it just scientific advances we are talking about, or just gimmicks that are used to advance our marketing and to get a name in the practice? Any objective of newer advances should be to make spine surgery safer, to shorten the operative time, make sure that the patient gets the maximum benefit, maybe shorten the hospital stay, and all the other parameters of healthcare, there should be a definite improvement. By that standard, there could be three subclasses of all the advances in instrumentation, in implants, and there are also enabling technologies to improve the operative results. The approaches and the surgical techniques also undergo radical technological change. In the last 5 years, we are doing now MIS O-leaf, A-leaf, X-leaf, MIS posterior stabilization, and also more and more advancing techniques which augment different kinds of surgeries. In implantation, we have seen radical changes. Sometimes the implant material is changing from titanium to cobalt chrome. Also the type of screws, the kind of dimensions, specific conditions like osteoporosis, we have plasma coated or cement augmentation screws, 3D printing implants, etc. Instrumentation for specific surgeries like this pedicle subtraction osteotomy surgery, or short sequential reducers for high-grade listhesis or grade 2 listhesis. So there are various technological advances happening. But if you see overall, they can be further categorized by their use. Those trends which have gone out of vogue because they have failed to produce sustainable results, those technologies which are being used only sporadically, not proved very scientifically or accepted, but still not gone completely out, and those which are well established, very promising, are taken up advances. Like this lumbar disc replacement, the lower right side photo is one of the hospitals which have on the website claimed that it's the best center because they're doing lumbar disc replacement. Now today, you will not even find the mention of this surgery in most of India or North America. Because the results are so bad, lot of complication rate, so disc replacement for lumbar is out. Dynamic internal fixation or dynesis, lot of implantation problems, screw loosening, failures, they're out. You can see the results of few surgeries, how disastrous it can be to do a revision surgery for this. Axial lift was a very novel, different concept for L5S1 listhesis, but because of rectal perforation and other difficulty in procedures, it is out. Nucleoplasty caught lot of imagination when it came, some of us did as well. It has gone out of vogue because there are no promising results. Laser discectomy, still there are certain people who are saying, but the percutaneous laser discectomies in literature have not proved to be superior or even comparable to the standard conventional techniques. So also the denervation and other things. Stem cell therapy, I have to be scientific on the podium, so I will not call it a hoax, but anything which is experimental, not approved by the accreditation agencies like FDA, and which has not been accepted by scientific community, still, few years back, every surgeon wanted to jump on the bandwagon and to do this. Today, it's mostly given up by a few surgeons. So there are enabling technologies other than the surgical techniques or implants also. And these are really promising, and they are really, really helping us to improve results. Dr. Ramchadda has already shown you a few. So in modern gadgetry in the OT, we have certain things which really help. Sorry. This is just to show that how the OR, the O-arm in the OT, can completely give you a circumferential three-dimensional picture, AP and lateral simultaneously, to improve the trajectories, to see the picture, and also improve your implantation techniques. There are also other gadgetries, like this bone scalpel, which uses ultrasound vibration and cuts the bone only. It stops when you go close to the spinal cord. So in many, many surgeries, like en-bloc laminectomy for the cervical spine or thoracic spine or calcified tissue, it could be very difficult sometimes to separate, or a high-speed burr can really cause damage to the soft tissue and the nerves. This is one technique which can be safely used. Mind you, in every neurosurgical OT in North America nowadays, you have this, because to do a craniotomy, it is the most widely used instrumentation in many, many institutes. So there are many, many techniques which improve the paraphernalia, shorten the operative time, improve the accuracy. So these are the augmentation techniques. Now, this is all which comes with the neuronavigation, right? And there are improved trajectories with neuronavigation, especially for cervical pedicle screw fixations, C1C2 fixations, revision surgeries. If you ever do a revision scoliosis or kyphosis, you will understand what I'm saying. Along with this, what is most important thing is the neuromonitoring system. So now we have a continuous neuromonitoring, including EMG and other modalities, which really reduce the possibility of a mishap in terms of neurological deficit. So all this together is trying to make the spine surgery safer. And there are technologies which are here to stay, like the cervical disc replacement. Like this case we did quite a few years back, and you can see that immediately following the surgery, the patient starts, let me see the X-ray is not coming up. So 3 days from the surgery, you can actually see the disc moving, right? So the disc replacement for lumbar is out, cervical is well established with long-term results, and it's really been accepted everywhere in the world. Osteoporotic fractures, insufficiency fractures where you require fixation, either you have to go really above, below, or use sublaminar wires with this, or you can have the cement augmented screws. Some of them are plasma coated, and it's really helpful. Dr. Chadda has already given us a beautiful discourse on robotic spine surgery. I need not say anything further. The newer robots also will have cervical fixation modalities, so it will really encompass all the plethora of requirement. Now, these are also certain other gadgetries which makes the spine surgery safer. Like the most important thing you must have realized is putting screws in pedicles. Even for a new surgeon or established surgeon, there is a definite 5.8% problem when you're doing fluoroscopy guided. But what if you have some instrument like this, which tells you real time, when you're putting inside the pedicle, that if it goes wrong, there is a continuous beeping. And with the sound that changes, you come to know if there is a cortical perforation and that you stop. Now, this is something really useful, used in certain centers. I saw this in Singapore. Albeit it's a little expensive because it's a disposable, but it continuously beeps. And the beeping changes if there is a cortical perforation. So this is just one technology to ensure that even if you don't have navigation or robo, you can make cervical pedicle fixation a little safer. Now, there are certain technologies which are given up and which are coming in vogue. Like when 20 years back, we learned there used to be memory alloys for AIS as a tether. And it was thought that as the child will grow, on the convexity, if there is tethering, like you have stapling for epiphysis in extremities, this will help. Now, which was given up, but it has come out in a big way in the last 4 or 5 years. Like last week, we were in Italy for Scoliosis Research Society. There are at least 3 papers, and excellent scientific publication is started coming in, where the anterior tethers really help in certain cases, which is done thoracoscopically. So these are the technologies which is making a comeback with a little fine-tuning or improvement which are there to stay. And then there are technologies where it is very, very confusing. If you see the literature, interspinous implants, many of the senior surgeons, they denounce, but there are also a lot of minimal invasive surgeons or even standard surgeons like me and Abhay. We are using for selective cases certain kinds of implants which have good results, right? So literature cannot be the gold standard for everything. You have to also see which journals, what kind of indications and where the data is coming on. So these are technologies which are still present, used sporadically. Now let me come to the basic of this question, whether scientific advances or marketing. Remember that any new technology introduced by a company has to go through a different cycle, from invention to marketing to actually making it available to public and making it widely accepted. Now remember, the most important step here is the marketing. Otherwise, none of these technologies will be available or known to us, right? So what happens when the new technology is introduced? There is a evolutionary cycle. First, the new technology is taking up people who are technologically very, very aggressive or pro-techies. Then the visionaries who realize the potential in a certain technology. Then the pragmatists, they will follow. Wide majority will accept. And the rest of the conservatives, the skeptics will never join, right? So you have a sort of a bell curve. Lower down, you can see innovators, early adopters, then the majority, and the late majority. So what does it mean? Actually, it means that it also depends on your personality prototype. Whether you are a person who will accept the technology fast, you really need a lot of wide literature or evidence to accept, or you are the person who will be so skeptical who will never accept, right? So the future spine surgery will see more and more technology requiring less and less personal talent, and you will be required more to accept the new technology understanding it. Like your smartphone, you really be talented to accept it compared to the newer generation. And probably VR technology and all this are not very far off. So judicious and conscientious use is very important. Go through the research, go through the FDA regulations, go through the journal, and accept it, because misuse and overuse is a direct reflection of profiteering and greed. The ultimate usage of technology depends on individual surgeon's wisdom to choose the best for the patient. Thank you.